Good evening, dear friends. In our previous class, we have discussed about peritoneal cavity. The peritoneal cavity, which is having two intercommunicating sacs, one is greater sac, another one is lesser sac. As I told you earlier, the two cavities, the two sacs intercommunicating means both are communicated with each other through epiploic foramen of Winslow. Now we have seen what are the peritoneal ligaments we can identify above the transverse colon. So above the transverse colon, that compartment is called as supracolic compartment. Let me show you the diagrams. Welcome to this topic once again. Try to observe this picture. In this picture, we have separated the GIT, stomach we have removed, liver we have removed, the small intestine and the large intestine we have removed. Now what we can identify is the cut ends of the peritoneum. Now try to observe here. We have seen the peritoneal ligaments of the liver. Those are nothing but the falciform ligament, and here you can identify the superior layer of coronary ligament, right triangular ligament, and then inferior layer of coronary ligament. And here we have seen the lesser omentum, and then here you can identify the gastrosplenic ligament. Then posteriorly you can identify lienorenal ligament. So these are the ligaments which we can identify above the transverse colon. So that's why this compartment is called as supracolic compartment. Below the transverse colon we can identify infracolic compartment. What are the peritoneal folds we can identify below the transverse colon? Yes. Coming to this, the infracolic compartment. So far we have discussed the two layers of the greater omentum which are going to become the four layers, and they are going to the posterior abdominal wall. They are reaching to the anterior surface of the right kidney, anterior surface of second part of duodenum, anterior surface of head of the pancreas, anterior surface of the body of the pancreas, strictly speaking, antero-inferior surface. We can also call it as inferior border of the pancreas. Then after reaching to these structures which are present at the posterior abdominal wall, as we know that the kidneys are retroperitoneal and the duodenum is also the retroperitoneal. The second, third, fourth parts are the retroperitoneal organs. Then after that, from here, the root of mesentery means the mesentery starting. Mesentery is nothing but the peritoneal fold of the small intestine. Now, as we have seen the two layers of the transverse colon, but here the mesentery having two folds, those are right and left folds. Now the mesentery which is extending downwards and it is extending towards the right side. Now this in between the two layers of the mesentery we can identify the superior mesenteric artery, superior mesenteric vein, and these are the vessels which are running in this two layers of the mesentery. As we all know that the small intestine is 6 meters in length, the superior mesenteric artery which is supplying to the jejunum and ileum as well. Now this root of mesentery, it is exactly present at the level of duodenojejunal flexure. From the duodenojejunal flexure, the root of mesentery present, it is extending downwards and towards the right side. It is reaching at the terminal part of the small intestine, that is ileum. Then after that, the ascending colon which is present retroperitoneal, descending colon is also retroperitoneal. After suspending this small intestine, again the layer, here you can identify the lower layer, that is nothing but your left-sided layer. Then after reaching to the posterior abdominal wall, it is further descends down, and then again it suspends the sigmoid colon as sigmoid mesocolon. So this sigmoid mesocolon is nothing but the V-shaped part. Now here we can identify two folds, superior fold and the inferior fold. We can also call it as right-sided fold and the left-sided fold of sigmoid mesocolon. So that is about the peritoneal folds in the abdomen. Now here you can see that. So this is nothing but your ascending colon, descending colon, and here you can identify sigmoid mesocolon. There is an inverted V-shaped part, V-shaped peritoneal fold. So what is the principle of peritoneal dialysis? So we can connect the catheter, we can insert the catheter into the abdominal cavity, and then we can extract the fluid from it. Now that is about peritoneal dialysis. Now in this picture we can identify this is the root of mesentery, how it is extending from duodenojejunal flexure to the right side of the ileum, where we can identify it is covering the ileum and also the cecum and appendix as mesoappendix. Now try to see here, right limb of sigmoid mesocolon, and this is your left limb of sigmoid mesocolon. Now coming to the peritoneum of the female pelvis. So what happens after covering or after suspending all the abdominal viscera? So this peritoneal fold which is extending into the pelvis. Now try to observe here, this is the sagittal section of female pelvis. Now we have seen up to abdomen, then after covering or after suspending all the abdominal organs, this peritoneal fold which is extending down and covers the anterior surface and lateral surface of the rectum, and is extending down, and then it is running forwards and covers the uterus. Strictly speaking, it is covering the posterior surface of the cervix part. Then you can identify it is covering the posterior surface of the body of uterus and also the fundus, and then see the same peritoneal fold which is extending downwards and it is covering the anterior surface of the fundus, anterior surface of the body, but this peritoneal fold anterior is not extending down. Then this peritoneal fold which is running over the superior surface of urinary bladder. Okay, then after that it is extending further anteriorly and move upwards and it is reaching to the umbilicus. So here you can identify the anterior most layer, and this is how the peritoneal fold which is covering the anterior surface and lateral surface of the rectum, posterior surface of body and fundus of the uterus, anterior surface of the fundus and body of the uterus, and then it is running over the superior surface of the urinary bladder. Now between this rectum and the uterus, you can identify there is a small pouch that is formed by the peritoneal fold. That pouch is called as the rectouterine pouch of Douglas. Now in front of the uterus, we can identify another pouch called as uterovesical pouch. This is the rectouterine pouch of Douglas here, and this is your uterovesical pouch. Now comes the how it appears when you take a transverse section and observe that. Now try to observe this peritoneal fold. So the peritoneal fold which is covering the anterior surface and lateral surface of the rectum, that is extending outwards. Then here you can identify a raised margin called as a sacrogenital fold. Sacrogenital fold. It is also this sacrogenital fold which is formed by sacrouterine ligament. Sacrouterine ligament. As the name says that it is extending from the sacrum to the uterus. Now this is the ligament which is present under this peritoneal fold. Now you can identify the two right and left depressions which are present on either side of the rectum. So these depressions are called as pararectal fossae. Then after that, this peritoneal fold, after running over the sacrouterine ligament, it is extending further anteriorly, and it is extending anteriorly and covers the anterior posterior surface of the body, posterior surface of the fundus, and then covers the anterior surface of the body and anterior surface of the fundus. Now it is running over the uterus, running over the uterine tube, over the uterine tube. Now, this layer, strictly speaking, we are calling it as the posterior layer of broad ligament of uterus. Now, the peritoneal fold, which is covering the uterus and the uterine tubes, that peritoneal fold is called as broad ligament of uterus. Now, on the posterior layer of broad ligament of uterus, you can identify these ovaries are located on it. Okay, then after ovulation, that ovum which is released into the peritoneal cavity, that's why I have told you that peritoneal cavity is an open sac in the females. So it is running from posterior to anterior and covers the posterior surface of the body, posterior surface of the fundus, and then covers the uterine tube or running over the uterine tube. At the lateral margin, the peritoneal cavity is opened. Now, after that, here you can identify posteriorly, we can identify the sacrogenital fold, which is consisting of sacrouterine ligament. Anteriorly, what we can identify is external iliac vessels. External iliac vessels. And posteriorly, we can identify the ureter at the level of sacrogenital fold and sacrouterine ligament. At the same plane, we can identify the ureter which is present. Here you can identify another raised margin. That raised margin is formed by the ureter. Now, between the external iliac vessels anteriorly, posteriorly ureter, this depression is called as ovarian fossa. Ovarian fossa, where we can identify the ovaries are located on it. Then after that, this peritoneal fold, which is running anteriorly, further anteriorly, and runs or covers the superior surface of urinary bladder. So far, we have discussed about ovarian fossa, pararectal fossa. So right and left sides of the rectum, we can identify pararectal fossae, and right and left sides of this uterus, we can identify the ovarian fossae. Then after that, this peritoneal fold, which is running over the superior surface of urinary bladder and further extends anteriorly. Now, it is not simply a small fold, it is a bigger one, so that it is the outside layer, parietal peritoneum, which is running at the. Now, try to see these paravesical fossae, right and left paravesical fossae. So, the outside layer, which is running at the uh, abdominal wall muscles, that is a parietal peritoneum. Now, after that, let us see that one by one. Here you can identify the sacrogenital fold, which is consisting of sacrouterine ligament, and this is the round ligament of uterus, which is forming the anterior boundary of the ovarian fossa. Ovarian fossa, and also the external iliac vessels, which are present outside over here. Laterally, you can see the external iliac vessels, and medially, you can identify round ligament of uterus. Now, here you can identify this is the area called as ovarian fossa, where the ovaries are located on the posterior layer of broad ligament of uterus. Now, this picture can give us a more information. Now try to see here clearly how the broad ligament, which is extending from posterior to anterior, the prominent sacrogenital fold, then this is the posterior layer of broad ligament of uterus, then covers the posterior surface of the uterus, body of the uterus, posterior surface of the fundus, and it is running over this uterine tubes. Okay, now here you can identify the ductus deferens. I mean, sorry, the round ligament of uterus, which is present anteriorly. Now comes the paravesical fossae I have explained. Now, after that, this is the section which we are going to see in the males, how it is present in the males. So let us see that. So in the males also same, it is covering the anterior surface and lateral surface of the rectum. Then after that, it is forming, it is running anteriorly, further anteriorly. Here we can identify the sacrogenital fold. This sacrogenital fold we can identify. Now here you can identify on either side of the rectum, we can identify pararectal fossae. And then it is the peritoneal fold which is running further anteriorly and covers the base of the urinary bladder, or it is also called as posterior surface of the urinary bladder, and then runs over the superior surface of urinary bladder. In the females, it is not extends on the base, rather it is extending only on the superior surface. But in the case of males, it is extending on the posterior surface of the urinary bladder and also on the superior surface of urinary bladder. Now, on either side of the urinary bladder, here we can identify the paravesical fossae, right and left paravesical fossae. Then this peritoneal fold, which is extending anteriorly, and from here, this parietal peritoneum, which is forming some ligaments. Let us see them. Now you observe the peritoneum, which is extending from posterior to anterior. Here it is covering the anterior surface and lateral surface of the rectum, and here it is extending over the base or posterior surface of urinary bladder and then running over the superior surface of urinary bladder. Here you can identify there is a small pouch. This pouch is called as rectovesical pouch. Rectovesical pouch. Now at the base of this pouch, you can identify a fascia called as rectovesical fascia of Denonvillers. Okay. Now this peritoneum, which is running over the base and the superior surface of urinary bladder, and is extending onto the apex of the urinary bladder, which is projecting anteriorly. Now observe this picture. So here we have taken a coronal section and we are trying to observe from inside to outside. Now after covering the superior surface of urinary bladder, it is running at the apex of urinary bladder. Here at the apex, what is present is urachus. Urachus you can identify from the apex of the urinary bladder, which is extending up to the umbilicus. Now this ligament is called as median umbilical ligament. Median umbilical ligament. Now lateral to this median umbilical ligament, we can identify the two umbilical folds. These are called as one on either side. Those are medial umbilical folds. Medial umbilical folds. So in this medial umbilical folds, what we can identify is obliterated umbilical artery. Obliterated umbilical arteries. Now, lateral to this medial umbilical folds, we can identify lateral umbilical ligament. Lateral umbilical ligament. So, this lateral umbilical ligament, which is consisting of inferior epigastric artery. Inferior epigastric artery. Now, here we need to understand the fossae which are present over here. Now, between the median umbilical ligament and the medial umbilical ligaments, we can identify two fossae, one on either side. These fossae are called as supravesical fossae. Supravesical fossae. Now, lateral to this medial umbilical ligament, here we can identify another depression. This depression is called as medial inguinal fossae. Medial inguinal fossae. Now, here I told you that lateral umbilical fold, which is consisting of inferior epigastric artery. Lateral to this, you can identify lateral inguinal fossae. Lateral inguinal fossae. So, lateral inguinal fossae, medial inguinal fossae, then supravesical fossa. These are the fossae we can identify, and these are the peritoneal ligaments which we can identify. One is median umbilical ligament, lateral umbilical ligament, medial umbilical ligaments, then lateral umbilical ligament. Then these are extending up to the umbilicus. So this is how the peritoneum, which is running in the pelvis cavity. The same thing which I am going to show you here is supravesical fossae, medial inguinal fossa, and here you can identify the lateral inguinal fossa. Thank you, dear friends. This is about the peritoneal cavity. And in next class, we are going to discuss about some other abdominal topics. See you soon with a new class.